Well, we have, so we basically have spent billions of dollars. We've created the infrastructure. Obviously, we did a massive vaccination drive with our seniors first, yielding almost 4 million seniors that have been vaccinated. We have close to 80% of everybody above the age of 50 in Florida has received a shot. We have the highest vaccination rate in the entire Southeast region, and we've put a lot of time and effort. So that is, the core of the protection. And I think you look, I've been able, and we put out a lot of this publicly, but if you talk to hospitals, you are seeing a big reduction in mortality, largely because of the elderly that have had protection. And so we think that that's a good thing. We want to continue to do that. We also highlighted, and a lot of people don't know this, if you do get infected, and particularly if you're high risk, there's very effective treatments for COVID, these monoclonal antibodies. It's an IV, you got to go in, it takes like about a 3-hour process, soup to nuts. But if you go in and you get it early enough, it's a huge reduction in hospitalization and mortality as a result of that. The problem that I think we saw was when we started talking about this more, people didn't know about it. And so we've tried to be very public about it. The reason why it's important is that if you get infected and it's in the mild stages, this thing will really work because it basically provides antibodies to fight off the virus. If the virus goes to where it's more serious, at that point the antibodies just don't work. So between the vaccinations, which were done, and I think we've done almost 12 million range shots or individuals, and then the treatments, if those combined can reduce this to basically a flu level risk. And I think what we're seeing with the elderly that have been vaccinated, you're definitely seeing a reduction in mortality. So we have that infrastructure in place. We also have a lot of stuff that we stockpiled over the months and different types of PPE, all that. Anytime anyone needs that, we send the Department of Emergency Management is working on that. And so we have the funding, we have the resources. It's really just, an issue of, okay, we're at a kind of a height of the wave, and we think it's following a pretty set pattern, and we'll know more probably in the next 3 or 4 days. But as that's happening, and as individuals who may be high risk for complications, they can get in there and get the treatment. That's going to make a huge, huge difference, and everybody throughout Florida, all these hospitals are involved in doing that, and we're big supporters of that. Yes, sir. Well, you tell me. If you go look around. So, I talk to people around the state. How are things going? And they say things are humming. And I think it's because, look, I get the cases, and I'm not saying you shouldn't report on that. Obviously, when the cases rise, they rise. There's clearly higher prevalence in the summer in Florida than in the spring. We know that. And there will be higher prevalence in January than there will be in September here. And there will be higher prevalence next summer than there will be next May. So we know that. That's a pretty consistent pattern. But I think that because so many people have either been vaccinated or have recovered naturally and do have immunity, I think folks are making their own individual risk determinations. I think most folks, including me, my view is, look, I got the shot, I got to do my job and live life, and I think a lot of people are doing that. So if you look, hotels are doing very well, businesses are doing very well, and I think you're going to continue to see that. And I also think that, what's going to happen is, we obviously have protected people's livelihoods, which is very, very important. One of the things that really irks me about people that want to shut down is you can't show me where that's actually worked, number one. And number two, it hurts people. It hurts their livelihoods. It hurts their ability to put food on the table for their family. It hurts family-owned businesses. Obviously, when you start talking about schools, we led on that last year. That's a huge problem if you're not letting kids go to school. So that is really important, and quite frankly, I think that's one of the reasons why you got people looking to buy homes in Tradition and all these other places. So I think that people understand, and I've always said this, you have some politicians that say, I am going to eliminate the virus, I will defeat it. unfortunately, government can't just end it. We still have 1918 flu floating around, so it's something that, if government could just end it, then people wouldn't even need to get the treatment because you could just end it, right? You can't. So we knew this is something that you're gonna have to live with. That's why we worked so hard to provide this, particularly for our elderly, for the protection of the vaccinations. But I think people understand that, and I think that's how most people are going. That's why things are continuing to move along in Florida. These waves ebb and flow. It's not something that government can control, and government's attempts to control that, I think we've seen throughout the country and throughout the world, have been incredibly harmful and incredibly damaging. Yes, sir. Well, I think one thing we're looking at, and we don't have the data in Florida on this to suggest, but you look at studies out of Israel where they're looking at how long the efficacy of the vaccine lasts, and again, we think we have strong results here, but we're already looking at that. We're looking at other countries to see, okay, and Moderna put out a statement the other day, if there's going to be something that's going to be needed, we want to make sure that we're going to the nursing homes, providing it for seniors first, just like we did the first time around, and it may not be necessary. I think the jury's still out. I think different people have had different things, but clearly, if you look at Israel, they were the first country to vaccinate everyone very quickly. I remember they did it, they vaccinated half the country, I think, in like a month. So that's December into early January. I remember people saying, why can't the U.S. do that or whatever? One, we didn't have enough vaccine to do that. And two, Israel's about the size of New Jersey, so it's a little bit different. But nevertheless, they did it. So they had people that have really been fully vaccinated since the beginning of the year. And then if you look at kind of how their outbreak has happened, they're one of the most vaccinated countries in the world, and yet they've seen spikes and they've actually seen hospital admissions go. So that's something that we're concerned about, because we really think that people are protected who have availed themselves of the protection. The hospitals all tell us that the majority of the patients that they have to admit and that then end up going to intensive care are folks that don't have the protection, either haven't been infected previously or haven't been vaccinated. So I think that is something that is going to be really critical to figure out. But in terms of imposing any restrictions, that's not happening in Florida. It's harmful, it's destructive, it does not work. We've seen, if you guys just look at what's happened in the United States over the last 18 months. Last winter, the worst outbreak anywhere in the country was Los Angeles County. They were one of the most restrictive areas in the country, certainly high mask usage, business closures, restrictions on personal freedom. So we really believe that individuals know how to best assess their risks. We trust them to be able to make those decisions. We just want to make sure everyone has information so that if you do get infected, you know that there's some treatments available that can be very good, but you got to get it early. And then we also obviously want people to know just the facts about, because you hear a lot about the vaccine. Our doctors and our hospitals in Florida believe that it's provided protection against serious illness and that has reduced mortality. Now, we also have to acknowledge that people who are vaccinated are still testing positive, and it's not necessarily creating the herd immunity that we had hoped, because if you think about it, in Florida, we probably have had 5 million or more people recover from COVID, and then you've had 11, 12 million that have gotten shots. You wouldn't see the uptick like you did if the vaccines totally shut it off. And so that's just something that we have to be honest about. But in terms of protecting against severe outcomes, all of our hospitals and all the physicians, they believe it's been very positive, and they believe that some of the patients that have presented themselves, particularly higher risk, had they not been vaccinated, they think that the disease would have progressed much worse. So we're going to continue doing that and continue in providing whatever help we can. Okay, thanks everybody.